Thursday, April 21st, 5:30 p.m. We're a little late. Board of Health meeting. It's hybrid meetings being recorded. Present at the meeting is Sue Braska, Jean Nielsen, Tom Fitzgerald, our health director.
Who's
Mackenzie Kane is absent. And our secretary, Cindy Barton. Do you have any
didn't go to me.
public comment? Peter? Do you have anything you'd like to?
Nothing today. Thank you.
Is there anybody else, Cindy? Just Peter? Okay. The minutes. Did you already read them, Jan?
Yes, I made a few corrections.
I don't even know what I did with them, Sim.
Cindy just brought them over to you.
Yeah, I know she did.
I made the corrections that she made on yours.
Tom, did you read them?
Yes.
You did too?
Only the Gene's corrections.
All right, so this is Tom and you. Okay.
Our corrections, yeah.
So make a motion to accept the minutes from April 7th, 2022.
And I'll second that motion.
Uh,
We need a roll call vote.
yeah,
Roll call vote, Jean Nielsen, yes.
Sue Brodsky, yes. Okay, so do you need these back, Cindy, or is this a photocopy?
No, those are.
Yeah,
Original.
whatever. I was gonna let you make whatever changes you want to that one, and then I'll take that one.
Okay, take that one. Okay. Tom. Go ahead with your report.
Updating the COVID numbers. Valerie gave a historical accounting from January 1st, 2021 to 1/31/2021. There was, in other words, January of last year versus January of this year. It was 1,280 cases.
Peter, can you hear this okay?
Yep, I can hear.
Okay, go ahead, Tom.
And there's 1,280 cases positives. And then from January 1st, 2022 to the present, there's 611. March 1st to April 1st, 35. April 1st to today is 39. 16 cases over 60 years old. 12 were vaccinated.
So 12 out of the 16 are vaccinated, they're positive.
That's not bad.
No, it's
Well,
not bad.
It shows good numbers that people are getting vaccinated. It shows bad numbers that people that are vaccinated are still getting it.
March 1st for today, besides the COVID numbers, Hep C, 2 cases, influenza, 14 cases, Lyme disease, 4 cases, babesiosis, which is tick-borne, 2 cases, and HDA.
And that's
1
from
case.
when? What are the dates on those?
March 1st to today.
Wow.
So there's 2 new hepatitis from the last time.
Yeah, these two new or this
These are March 1st till today.
March
So
1st till today, so you might
probably
have already
not.
had them.
Yeah, probably already.
But you said 4 lines?
Yes, 4
to-
lines,
to
2
the
babesiosis.
BCA?
Yeah.
The BC is BABESIA. Cindy.
What was it?
B.
BAB.
BABESIA. It's a tick-borne.
Non-contagious,
Right.
but it just shows ticks are out there now.
Sure are. Mhm. They contribute to more disease than serious disease, and I think than even Western Isle.
Okay, go ahead.
Sign offs 46 Will Palmer Road. And they're signing off 26 Noble Street Crossing.
They're both repairs? No, the 26 Noble Steed would be new,
Correct.
and the
That's right.
46 Will Palmer,
Will be a repair.
a repair.
Correct. Perk test 77 Foster Road. Final inspections of lot 1, house number 2, Hummingbird Lane. Inspection 11 Falmouth. Food service inspections, Big Y Foods. Blossoming Acres. Did a review with the building inspector. They're putting up a new building and they're going to be doing some raw vegetable washing in the facility.
So is the new building gonna be right behind it? or-
Yes. There's a nice building that's not completed yet, but we discussed some issues of
Whatever
with
happened
the
to that
plumbing
barn,
inspector.
that barn in the back?
They
That
had
was
to
in
take
the-
it down. Yeah,
took it
that's,
down.
yeah. It would have fallen down. That's a good idea. Food service inspection at McDonald's and Dunkin' Donuts at Gillette Corners, and the well permit 8 Rising Corner.
Now, there is no issue at any of these restaurants as far as your inspection goes, right?
Correct.
Okay, what happened with Dunkin' Donuts and they don't have a food establishment?
Nothing. At this point, the letters still haven't gone out. They're being, remember I said they're being reviewed by town council.
All right,
Our finding procedures are also being reviewed from the originally from the
so
regulations that
when
we
you went to
passed.
these places, was a manager there at all?
No. Yeah,
Dunkin'
actually, that
Donuts.
was one of the violations I noted to him. But since he wasn't there to get in with it, I wanted to give them something in writing that's beneficial before I just started talking to them.
8 Rising Corners, that new?
Yes, but that's interesting because the well is in Southwick and the septic system in the house is in Agawam. So it's a little bit confusing. But the owner indicated that he had spoken to both towns a while ago when he was first contemplating purchasing this lot that straddles the 2 towns. And they said that wouldn't be a problem. So. Cindy Sullivan and I are working on having a booster clinic for seniors. And are looking at mid-May for that. We threw out some dates, a Friday, second Friday in May is a possibility. We still have to iron out that we've sent the request in. I sent the request in, and we're talking with them. We'll be talking, finalizing the information to get the Vaxmobile here.
Is that would be curative coming to do it?
I
Or?
don't think it's curative. And I think I think curative is not doing vaccine clinics anymore. This is another kind of vendor with the state. So we're dealing with this. We're dealing with the state directly. Then they do their thing and get the machine, the vax people out here. So we're playing phone tag, but I think that they're going to be approved to approve that date downstairs
And
from 9 to 12.
Would it be Moderna, Pfizer, both of them?
Yes, it can be both of them. Yeah,
Okay.
it is going to be. I think we talked about it. It's going to be open to the public.
People have to call, make an appointment?
Yes, and possibility of walk-ins. We're trying to keep it as flexible as possible, but if they can do it, they
Now-
can do either.
Are these free of charge, this booster?
Yes.
They are?
If
It is?
there's, I think if they have insurance, the insurance will cover it, and if not, it's free of charge. In other words, if your insurance covers it, they'll take the insurance, and if it doesn't, and you don't have insurance to pay for it, it's free.
What
So-
was the dates for that?
Well, I didn't want to nail this down because we're looking at it, but they haven't confirmed they can do it. In other words, there's other entities they're competing with dates, so that's the one Cindy thought that would make the most sense. So that's when the application was for. We haven't got confirmation that is going to be the one they're going to approve. So I'm a little hesitant to tell them when exactly it'll be advertised. We'll make sure that we have it's advertised before we do it. But it looks like that's a Saturday. But I don't
So
commit yet.
you think it'd be on a
because
weekend?
we haven't got it. Yeah, that's
Be a
one of the-
Saturday?
Yeah, that's one, but again, that's not finalized yet because we only asked for that. Doesn't mean they're gonna accept that yet. So when we know, which we should know early next week, if they're gonna agree to that or not. Update, Mr. Chair.
Let's go back a minute. Remember way back, was it in February or whatever, that they were going to have a testing? Curative was going to come do testing here on a Saturday.
Yes,
We knew it was going to happen, but then at our meeting, the following meeting, we never talked about what happened. Like, was it successful, or you probably don't remember because it's been 2 months.
no, I remember. I was there. We had one person.
One person.
Yeah.
No.
I thought they had to have at least 200 people before they'd come.
No,
And
I
they
think
did.
that's what they wanted, but I think part of the problem was it was before they. It was either before a long weekend or we couldn't get confirmation and posted it. We posted less than 48 hours before, so I think that part of it was the people didn't have enough time to. Some people would have come, and we had signs out. We advertised it was on the town website, but it didn't hit it until 48 hours before. And I would have liked. That was not anybody's fault, except that they didn't tell us. The curative folks didn't tell us that it was definite until 48 hours before. So we couldn't post it 48 hours before. So that's probably a factor. But if we thought the need, again, they would do it. But there's not like a pounding need.
So Cindy, what this is about? Back in, was it February? I can't remember. Curative, CURATIVE, scheduled a testing.
Site.
Yeah, they were going to come and they would collect the specimens and then send them off to be tested. And it was on a Saturday, and only one person showed up.
One person canceled.
Well, there certainly would have been two. Did you get tested there just to make it three?
Actually, I did.
2 people?
No.
Well, I think part of that was there's the home tests were
Right.
so readily available.
That's
And by that point,
Yeah.
I mean, even if you had an inkling that you could have contracted COVID, that you probably just did a home test. More convenient.
It's true. So our numbers that you gave us are probably lower than.
yes, because of the home tests.
Yeah.
Yes, as they have been for quite some time. Yeah.
Okay, the shared service.
We finally posted, thanks to Cynthia and Labor Council. We posted the both the part-time and full-time nurse for the shared services grant. So that's out there. We're going to be taking that. We have to develop some vendors and account numbers, as Gene and I had spoken about, for the separate categories of people with the grant, because the grant is in. We have the money. So Laura is going to have to be working with us and getting some separate contract language.
So can we get the
separate
vendor numbers even before we hire the people?
No, I don't know whether vendor numbers is
some
better
people
than the budgeted line item account numbers. Not account numbers is what we're looking for. For example, Cindy had posted or sent the newspaper the Help Wanted ad. It's already been in the newspaper. We already have an invoice for those Help Wanted ads. But we can't create a purchase order because they haven't given us the account number that the grant money was put in. You know, like everything has an account number. And I asked her 2 days ago, you know, what account number are we going to put on the purchase order? Because Carl says the money for advertising is coming out of that administrative part of the grant.
Right.
But we don't have account numbers.
All right, so they're gonna give us an account number and then put that money so that when we get our budget monthly, it'll be on there?
I don't know that it'll actually be included in the Board of Health budget report because it's kind of its own separate entity and they do generate separate reports from what the Board of Health line item budget is. So it should be submitted as two separate because essentially it's not part of the fiscal year Board of Health budget. It's a separate grant budget.
Mhm.
So it's kind of under a different category. You know, like the gift accounts, that's not included in the budgeted line items, but they do send out reports on a separate accounting, you know, document showing how much money is in there, how much is used, etc.
Okay, so so this expires the end of June, this first go round. Tom, is the end of June or June 1st?
The end of June fiscal year. It corresponds with our fiscal year, June 30th.
June 30th.
Yeah.
So now who is Tammy going to re-up our,
Yes,
do we know? Does she know?
yes, she was at the meeting. She was at the meeting yesterday where they discussed this, and I got a little report from her.
All right, so she's going to reapply or whatever to renew it.
Yes,
All right.
and obviously they must have understood that we got the money so recently. We haven't got anybody employed other than these small expenditure. We've just begun to scratch the surface of the grant, and they know that because they didn't give us the money until March. So there's no way we were going to be able to hire people and spend that money right now. So it's just going to be folded over to the next grant cycle, I think.
So when the applications come in, you're going to disperse them to the other towns?
Yes.
And is it going to be like a joint interview from representatives from
Oh,
each town? Provided you
Yes.
can even get anybody to apply.
Right. Well, I guess we could certainly discuss that. But yes, all the towns will be invited to the interview for sure. All the other towns. Actually, besides that, right? So the jobs postings out. All the towns got copies of it. Tammy, sent those out after we advertised. So wait to see what we get. In addition to that, related matter, I was discussing with Westfield and West Springfield the possibility of applying for a grant for a mental health person for multiple towns. In other words, the same analogy as a nurse. However, a couple of things came up as a result of that discussion with Mike Hugo, who's working as a liaison for the DPH in this grant cycle, is that he told us that that there's only one grant, shared services grant, that's allowed per town, and we have one. Obviously, it's the nursing one. The only way we could apply and get more money again with others, towns, new towns, for instance, Westfield and West Springfield, would be to remain as the host agency for the new grant, or added. That's not really a new grant; it's an addendum to the original grant. Talking with Mr. Steinhardt, he indicates that he doesn't want to do that. He doesn't want to add. He doesn't want to have any more host agencies besides this one. For now, indicating that it's too much work. So that really shuts us out from having even applying for that, because only the host agency can add towns. Okay, so if we can't, if we're not allowed to do that.
So you mean Granville couldn't, or
Right,
Russell couldn't, or
right.
whatever?
So west of the host agency, always the host
Okay,
agency.
all right.
That's only part of it. But here's the second part of that issue was the fact that we only have the grant is around 180,000, right? 179 and change. The total grant award for any shared service grants 300,000 now. So even if we were able to convince the select board to add this on to our host agency responsibilities, it would, that 180,000 would be subtracted from the 200,000. So that would leave us really with 120,000 for one position. And that one position would now be spread with under 8 towns, including Westfield and West Springfield. So in thinking and talking about this, I had a meeting with Gene and Joe. We don't even know how that would work because now you're really spreading the money fairly thin. Our hope is that maybe the state comes up with a new formula that allows different host agencies, more than one host agency for multiple grants, because that's not going to work for us. One position. And the other thing is maybe the 300,000 is low, even though that's what the rules are right now. Doesn't mean that can't change, but right now 300,000 is all we got.
So you can put it on the back burner essentially.
We can't,
And unless
unless they change the way they're saying right now, only one, we have it as a host agency.
300,000 for one person for 3 years, 4 years, 5 years, what?
No, these are renewable.
Okay, but 300,000 for
Right.
1 year?
Right.
Or we're not gonna give, somebody's gonna get,
We're not going to get that because we already have a grant that was 180,000. And the only way we could add that to our,
so we get 120.
more, but we'd have 2 more towns.
Oh, okay.
So we'd have
Yeah.
8 towns
Yeah.
with one environmental health person.
That's
Originally, we were talking about 2 until we were told that no, because this wasn't very clear from the discussions in the grantee meetings that you're only allowed to have 1 grant. And that may be because the state wants to spread it out and have as many towns be shared services first. And then maybe when all the towns in Massachusetts have some sort of shared services grant, then they may open it up and say, well, okay, we saturated the whole town with grants for the first round. Maybe we'll change the formula. But right now,
okay.
we're done with it. I mean, we can't do anything more.
so no more grant applications. As of now,
Not for
not for
this,
additional.
not for this particular
us.
one, unless they change something or come out with a new grant formula.
We wanted, can I have since I'm not at work, print out anything? Do you have the new letter of understanding or whatever for the full-time one
Yes, we do.
from
Yeah,
Carl?
yes.
Yes, we do. We have a blank one. Yep.
That's for the 3-year.
Right.
Yeah.
Correct.
But we're at this point not.
I have a copy of the 2-month one.
Right. But
Oh.
That's the
Oh.
only thing in place right now.
So you do have that.
I have a
That's what
copy,
that's,
The copy.
Well, that's,
a copy of it.
Yeah, but where's
Cool.
the original?
He doesn't have it, or just,
Alex has a copy of it and the other copy went with in your stuff somewhere.
No.
Or Jean's stuff.
Oh,
But I
he
have a
got, I
copy.
think he got original. He got an original.
He got an original.
Right, so where's
Oh,
the
okay.
original?
So-
I did not get an original. I never found, I looked all over the place. I don't have it.
But the one that Carl revamped.
Yeah.
Do we have a copy? I don't have a copy of that because I haven't printed it out. That's what
I
I'd
think I
like,
sent, I think that. I
a
sent that-
copy of that.
I think I sent that out to everybody.
Right, you
Yeah.
did, but
Well, you can't
You want a
print
hard
it.
copy? Want a
Yeah.
hard copy of the blank? Yeah.
if I can get you.
double sided.
For my files.
Do you want a copy of this 2-month?
No, I have.
Okay, we'll go make a copy of this. Be right back. Right back, you man the.
Okay, I got one. Hang on.
Okay, my copy's all marked up.
Okay, Tom's gonna
Tom's going to
get me one then.
a copy. For you.
Okay, so we did sign the 2-month one.
Yes,
Um,
yeah, he'll be official for 2 months as of May
So he's gonna,
1st, which I think Monday is May 2nd.
all right, so
So
he will be at our next
at our next meeting,
meeting.
my last meeting.
I thought this was your last meeting.
Yeah, me too. But the elections aren't held until the 10th
Okay.
and our meeting is before the 10th.
So you're
And,
not on the roster to be revoted in?
No, it's, on the ballot.
No.
I chose not to run for reelection, so.
A copy of this.
Yes,
First, this is the.
Yeah, so you can talk about that when Alex is here. For your next meeting.
Okay, so this is the original.
It looks that way,
So
because it has a
I'll make a
signature.
photocopy, make a photocopy of it. So when Alex starts for his 2-month period, Tom Millipole, you're still gonna be, I see all the nursing applications are gonna come to you. And then will you be at our next meeting?
It's that date. Yeah, I think
It's
so.
the first Thursday, and
Looking for 5th,
Yeah.
May 5th.
you'll be at that, okay.
So Tom can still work X amount of hours in those 2 months. To acclimate Alex to the position.
Okay.
And then, who knows?
Right. So Tom, you work it out with Alex then?
Yeah.
How it's gonna, what days he's.
What
gonna be
days
here.
and, yeah. And
Now,
again, it's only part-time.
right, right. And then town meeting, they're gonna vote on our increase.
On our budget.
And part of that includes Cindy's extra 5 hours. And
Yes.
then the extra for the
Right.
health inspector.
Right. But Cindy's also been working as a floater. And as a floater, she can do Board of Health stuff. So she's, assisting in, you in the select board's office today while she was doing Board of Health. So those hours won't go against the Board of Health budget. They go against the select board's floater budget.
How many hours you been putting in a week?
I did 20 last week, and I think I did like 13 or 14 this week.
All right.
I think about 11 maybe.
Well, thank you.
You're welcome. Might
I
be.
hear good things about you.
Yes,
Thank you.
she is. She's an asset to the town. She really is.
Agree.
Thank you.
Okay, so next is the well regulations. I haven't had a chance to look at them. I've
I
been
have.
straight out.
Is this something like, do you think Tom will just adopt those, period?
No, I don't.
I mean, I went through them and
No,
a
there's
lot
some,
of it is similar to what we
yeah,
have,
but some of it isn't.
and then a lot of it isn't.
Right, well, that's
lot
that's
of-
why I wanted to go through, well, line by line.
This
find
one,
out why you wanted
this
to
one, I
keep it
think it
down.
just seemed like a work session.
Yeah.
And just. Also going back to the nursing, when they do the interviews, I was kind of hoping that McKinsey could be in on the interviews for us.
For representing the Board of Health. She would be the only Board of Health member at the interviews.
They can only have one.
Because if there's two Board of Health members, that would constitute a meeting of the Board of Health. So that was, but I don't know if that counts for interviews. You'd have
Yeah.
to get a Carl or a Michelle to find out if interviewing for a position could
Well,
include more than
No,
one member.
so it would probably be the health director. Just wondering, could it be the health director and then could it be McKinsey if she's, willing? I mean, she's the one
Yeah,
that's got the
again.
nursing background.
If you only have one, it doesn't constitute a meeting. But if you have two members of the
So we won't
same,
do that. We'll just
of
have,
a 3-member board,
yeah, no, we would just have,
And I think from the other 5 towns, there may be other people on those boards of health that are either nurses or have someone that wants to come in and interview.
I wonder if they're gonna just have so many people, period, or could be intimidating.
Yeah, we haven't worked those out yet.
Yeah.
We haven't worked that out yet.
we haven't gotten an application yet.
Well, then, yes,
So-
no, but I mean,
When
It was in
posted?
the
Those things-
20th. It was in the paper on the 20th
Or so it was just yesterday.
yesterday. Yeah, we have a copy.
Yeah, I did
Yes, and you got me.
the-
Yeah.
Was MOAH or MAOH?
Oh, yeah, you did get to post this in other health.
yeah, MHOA,
Yeah,
yeah, Massachusetts
posted on
Health
the
Officers
Massachusetts.
Association, yeah.
Oh, good.
Okay, so applications should be pouring in.
Bet you can't post them like on the bulletin board at hospitals.
Yeah, I don't think that'd go over well.
You don't think?
Yeah, I don't think
You
so.
work there. You just posted at your hospital.
Just drop it around.
Especially when they're short on
Yeah,
people.
Yeah.
So
so
what do you want to do about the wells? You want to have
Well, we could,
a work session, or do you want, it wouldn't be a meeting, if just like you and I went through them?
sure. Yeah, you and I could set up some time to do that. Sure.
Want to do that then?
Yeah,
Yeah, because Sue's retired now.
Yeah, well, I'm gonna be working still,
Yeah, per diem, not regular,
not 5 days a week.
not 5 days a
Yep.
week, so.
I can relate.
So maybe next week or the week after, or
Sure.
what's your
The next-
schedule?
next week is fine. Yeah, I mean, it's gonna be busy. I got 3 perks already to line up. 1 already, 2 more.
What do you have next Thursday?
Next Thursday may be tough. Monday or Tuesday.
Can't do Monday, Tuesday. I'm babysitting for a dog.
Thursday.
Bring the dog with you.
Thursday morning.
Do they allow it here? No,
Thursday morning.
Thursday morning.
Yeah, we could do something Thursday morning.
When's your, okay, Thursday morning then. Can you write that down?
Put it in your phone.
Yeah.
To go over, what do you guys need to go over?
The well regulations.
And what time?
I don't know.
It's up to you.
10 o'clock. 9 o'clock. 9 o'clock. Is
9.
that good?
And we'll just go through it and then present it to the board. And then we can go through the septic things too and present to the board.
Well, you want to go through that one too?
Well, the septic thing is already done. It's just, I just want to make one correction. The revision, I mean, is already done.
For the septic regulations?
Yeah,
Well, yeah, I would definitely like to look at
ours,
that.
yeah,
and do
because the
some other-
ones in effect are the 1998.
Well, do you have the revision ready? So you
Yeah,
can get,
I sent it out to everyone,
okay,
but
okay,
I want to make
okay.
one correction, so we'll make that correction and then resend it.
okay.
And it's basically what's already there, but we took out all this other stuff. This is when the new Title V came out, so we had address perks before the new Title V, and then address
Well,
perks
98
after
was
the
after the
Title
new
V.
Title V.
Right, so we had address perks before the new Title V and then after the new Title V. So that's basically taken out. So now they're shorter.
Oh, I see.
So that's basically the only difference.
But I think one of the things was the issue of the whether it expires in 5 years. I think that was one of the issues that one of the questions
it's,
that we had,
Reviewed on a case-by-case basis.
that are over 5 years.
So for example, that woman,
Yeah,
Numbers.
Rosini. Yeah,
yeah, so it was just reviewed case-by-case basis. It was fine. But it should be, I think, come to
A meeting.
the board, yeah, if it's over 5 years, because you don't know what's been going on around it.
well, that would also be up to the designer because this is just perk test. So the next point is design. If things have changed, the person that's doing the design is going to be looking at those. In other words, let's say somebody built a house next door and there was a well that infringed upon the perk test. So by definition, that would get addressed by during the review process by the designer engineer.
Right. Okay, so the well we're gonna put on hold.
The Full Circle Technologies.
Yeah,
That's the
you
last thing I had.
gave us a copy of that.
I did.
This is like bringing Board of Health permits into the modern world.
Yeah,
This is the e-permitting.
Yeah,
So my question with that is, everything that's already done the way it's done doesn't need to be put into the system. It'll just be kept the way it is, and then I'll start fresh with all the new stuff that comes in once the e-permitting is set up. I don't have to like backlog all the ones that aren't.
you probably would. You know, if it has a data,
Well, because I
a database.
asked
Yes.
Karen, and she said that they didn't do that for the building department. They just kept all the records that they had and then went on their way.
Yeah, but
Started
Karen wasn't here when they did that.
Oh, well, that's
Yeah.
what she said.
Yeah.
Right,
Because she said that the old ones are still in the files and not on the e-files.
right. And what was supposed to happen when they created this system was do a scan of all the pre-existing
And then load them.
e-permitting ones and then load them into it. So it wouldn't be a matter of, you know, 1 Smith Lane. Is it in this file? Is it in that file? Is it e-permitted? Was it, you know, paper? So all of that was supposed to be uploaded. So, you know, in my opinion, if you get a tool as valuable as this, it would be good. And even though it would take a tremendous amount of time to have everything in one place.
But is this just for, is this gonna be for restaurants and septic and everything?
There
Or
is-
just,
Think of it as it's like a smorgasbord. As you'll see from looking at that, the answer is yes. And for each thing you add, each module you
you have to
add,
pay for
you
it?
have to pay
Right.
for.
And then you have a monthly, you have a yearly fee also?
The year,
Right.
absolutely, yes. That's
And you probably have a maintenance fee.
no, that's if there's a problem, they'll come out.
Yeah, but I'm talking about uploading. You know, like if they have something to rewrite the program to make the old an existing program easier to navigate. So they would have to upload improvements to the system you buy.
So this system can only be loaded on one computer?
No.
You can load it
No,
on
it's a share.
all of them?
Yeah.
It's access through, like the web?
So yeah, so if you look
Yeah,
at the
you just have to log
the
in.
last 4 pages, so you'll see that
That's what's going to kill is the annual fee of $6,000.
Oh,
That I think,
which one are you looking at?
so
page 9.
what's building pay? Do you know?
On page 9. Okay,
Page 9.
yeah, my numbers are not copied, so I'm not sure what that is.
Oh, it
What's,
says
what's the heading? What's the heading on it?
FCT cost proposal by module and service.
They got the building one here too as well.
It's a pricing table for permit eyes department modules.
Right.
You see
He's
that
got-
one?
But he's got the building in that too. Yeah.
But it says on the left side here,
Yeah.
permit eyes program for a Board of Health module,
Yes.
and that annual
11,500.
fee of 5,800
That's
is
right.
included in that.
Yep.
So that
This
one,
is,
I think that one would be a hard pill for the finance committee to swallow.
that's a lot. That's,
Well, I think that was always the issue in the past.
Mm-hmm.
But those are the numbers right now. And I actually sent this out so that Doug the Moglin, when we got it, just to apprise him what. Plus he's computer savvy and
can you come up with a program for us? Can you make a program?
Kind of hard. And if you look at this too, Tom, each module has a yearly. So
Yeah,
the Board of Health module is an annual fee of 5,800. Then the food inspections would be 1,670.
so in the 11,500,
That's just for the
software.
program.
Yeah, it's the software.
that's just for the software, and then you have to buy these individual. This is way over, this is,
Well, that's what the building.
Yeah.
That's what the building department paid for X amount of years ago, and they're paying every year.
I'd be curious as to what their annual fee is. The
Well, I
building
think I was looking
department.
at, it's very similar. I'm looking at the on this page, it's very, very similar.
is there another company out there?
Well, no, we thought of that too. The problem is, and that's certainly an option. You look at that. The trouble is, it's got to be compatible, or else, if we don't want to have mix and match of them. However, with the existing software, and I've discussed this with the select board as well as you folks, as well as Kyle, that as a minimum for the future, we need to make sure that no permits are issued from the town once the Board of Health notifies the Treasurer Collector's Office that there are permits, is paperwork or fees outstanding from like December on. And so in other words, that would go a long way towards solving the problem of people not paying for their permits and getting their paperwork in on time. And it's number one. And also the second issue that I've obviously addressed with Kyle, building department, is that we want to have a separate module for wells, because now we have 2 subdivisions going in with wells. Actually 1, but there are proposed another subdivision that's going to have wells. So we want those in individual houses that have wells, not just subdivisions. So, and we want to keep that an individual module for at the Board of Health level in the e-permitting that's existing right now. So we're doing that. But in addition, we used to have the yellow card, the old building card, before a certificate of occupancy was issued. For some reason, that's maybe because it's permitized. They don't have a yellow card, but there is a mechanism in talking with these folks from Full Circle Technologies that the building department does have the capacity to do that. So what that means is, instead of just authorizing plans to be approved, like septic plans, on the end of that, before the building inspector issues a certificate of occupancy, all the town boards that are involved with permitting early on get to check off that it's been completed. And that's not the case right now. So, the conservation as well as it's the health.
But did you just say that the building module has that capability?
Absolutely does. I talked to him about that. Yeah.
And that's not extra. It's something he already has, right?
It probably is a little bit extra, but it's hugely important, because right now there's a gap in this, and the way the system is working. That also is true with driveway permits. DPW, they sign off on it, and that's an initial, and then at the end,
Why do we have to buy the software again when the building department already has it? Why can't they just add ours onto there and we all use the same one and have access to everything?
Well, because that's the software for all these restaurant stuff is a whole different set of software. Yeah, I mean, we are doing it. We are doing it to some part already. We're the septic and stuff. We're adding the module for the well right now, but we're talking about all the other permits we issue, including, as you well know, all the ones we issue. That they have their separate database for that.
Right, so he is adding the module for the well?
Yes,
Building is
yes,
doing-
I've already asked, exactly. Right, but it's still, there's no check off at the end.
No final
Everything's all
check.
set. Exactly.
Like your yellow
Yeah,
card.
no,
where
And that's gone.
everybody
Yeah,
says,
that's good.
That's gotta
That's
be,
gone.
that's gotta be instituted. So it's gotta, even if the electronic yellow card is missing, and that should definitely be addressed. And I talked to him. Kyle agrees.
So it's a good system. Unfortunately, there's still no final inspection.
So I was thinking maybe, there's a couple things we could look at, alternatives, and see if it's compatible, or put it on the long term, the 5-year would be another option. Or a third option, look for grants, technology grants. I mean, as you see, we have grants coming in for nursing and shared services grants. So it couldn't be that. We've already discussed the fact we can only have one grant for shared services. However, there could be other technology grants that could be available, and we will keep our eyes open, and I'm sure the future director will do that as well, because I know some towns have gotten to digitizing forms and going on electronic. Now, maybe that was their shared service grant also. Maybe, I don't know what town they were, but actually, I'm not sure, but I think it's the western northwestern part of the state. So that may have been, if it was a shared services grant, that's it for them as well. If they got that grant for doing that, then they're done with the shared services grant, just like we are. However, it might have been another technology grant that DPH, federal government, offered, which I'll certainly keep my eyes open, and I'm sure the future director will too.
Well, this is something that you have almost a year to figure out, because if you decide to adopt some type of technology, it has to be included when you submit your budget in February.
That's what I was saying. Maybe even the 5-year plan.
Yeah.
And then by that time, these prices will go up. This is crazy that the annual fee is
I know.
half of what the installation is.
I know.
Well, actually, if you add up all the annual fees for the 3 Board of Health related modules, it comes up to $8,070 a year.
So looking at that, and you can reverse this, what we're thinking, and saying, well, maybe the e-permitting for the building department, we should look at that. Is there any competition for that is just as effective? It's not as expensive. I mean, did anybody?
But would the building department then have to get all brand new software and learn all those?
I'm just saying that
unless
maybe there is something there, maybe something that would be more competitive. Well, especially if you're talking about doing it for long term. In other words, sure, if you look at 1 year to another year, it may not be cost effective to do it. But if you have a competitor that would come in and say, you know what, if we're going to be doing it for X amount of years, we're saving X amount of dollars every year, theoretically, then maybe it would make sense. So it's something that maybe the technology people that could look into, because I don't know what the research. I wasn't involved with the research around this originally, so maybe there is something.
Do you have to? Okay, so for example, at the hospital, you get a new analyzer. We usually buy a maintenance contract, but you don't have to buy the maintenance contract.
Right.
So do you have to buy the support and maintenance contract? Of course, then if you don't have it, then when you do call for support, they do charge you.
Right.
You have to give them a PO. But
it's a good question.
Just wondering.
Yeah, but see, they include the word maintenance in with support. So in other words, it's like any other program. If there's some kind of glitch in your program and they have to rewrite it to fit what you need, and that would be their maintenance. Because like everything else, it's a car. You have to continue to maintain it in order for it to function as you purchased it.
Yes.
It's just a lot of money.
But that's why I think they throw that maintenance in there too. That maintenance word.
Yeah.
Also, do they give you some kind of discount if you already have the system and you're doing another one?
Well,
like 50%.
The answer is it's written right there. They know we have it. They know we already have the building site. So whatever is in, that's either the discounted cost or there's no discount. But that's it, because they know we have it already. It's a good question though. But I mean, there's no doubt about it. It's pricey, and maybe the building department generates more permits, more revenue than we do, and those are a good economic analysis to see if it makes sense too. We could look at, this would be a subcommittee to look at this program versus this building departments, how much they're generating, for revenue, whether that is offsetting the cost of their fees, and whether it would be the same with us, or it would be a net loss or more of a loss than for the building department, for example. In other words, this is why,
I guess you just look at the town report and see how much the building department generated and how much we did.
Well, there's fees going out too with the inspections, and whether they have 3 inspectors and assistants. It's like they got people going out doing inspections and sometimes re-inspections. So there's a lot of overall, I think that makes sense. But we got to find out how they're generating their their permits. Maybe, maybe as such as that you could add a fee to apply, every time someone applies besides the actual application fee, if you're going to use electronic versus paper. Some, because some places still do that. Maybe they still allow it to have both.
Maybe we should go back to the yellow card until we have this.
Yeah, the yellow card was a lot cheaper. You just
Yeah.
make copies of it.
Right.
We've got to do something in the meantime, because
Right.
I don't see this happening.
No.
Anytime soon.
No, I didn't expect it to be that.
Unless there is a
long-term
grant out
plan
there.
And looking at the grants. Yeah.
Oh, well.
So like on this short week.
Okay. Cybersecurity training.
I've been taking the modules that are required.
I keep failing my last one. It won't let me finish. Because I don't understand if I'm going to get hacked using my town issued laptop as I'm traveling internationally for the town. So it has nothing to do with my job. And I'm not technologically savvy, and I can't get through the last one. It keeps telling me go back and do it again. I even write down my answers the first time I do it. When I go back and do it again, I use the same answers, but apparently they're asking different questions.
They put them in a different order.
So
Yeah, I mean, there's a lot of it. Seems like I was, this is going to be quick, and then
Yeah.
they come up with, they give you new ones and stuff, and there's like, I'm still like 8 modules behind, and it takes a while to do those. You got
Yes,
to
it
read them,
does.
and then some have audio video recording. Of
That's for
what's
all the
going on.
employees of the town.
Yeah,
yeah.
I
it
used
comes
to do it
from
when I
the
worked
state.
at Mercy
Yeah, you have to do
Hospital.
it, right?
It's very extensive.
Yeah,
all
very.
the
Well,
stuff
maybe
they
you
ask.
can come and help me do my last module, but I don't understand how they group, all of these cybersecurity into people that what they're asking is for. We absolutely have nothing to do with it. Nothing. I will never travel internationally for the town of Southwick, but that was a module. Why?
I don't have to do it, right? I haven't gotten anything to do it.
You haven't? No.
No, if you haven't, yeah, you.
Who
Town
do-
employees,
who
I
do
guess.
Town
Just in
employees,
town
yeah.
employees, not board members. Apparently. No.
Yeah.
Yeah, because you can get one
That
as a
makes
board member. You got
sense.
one
And
as
you
an
don't have
employee.
a town email.
No,
I think that's.
Yeah.
That's part of it.
that's why.
Okay, you gonna be in the office tomorrow?
For a little while, like after. When I run.
Okay, so you wanna come up and cheat on?
I'll try to help you, yeah. It might be different from what I did. with Josh. I just gotta hand in my time.
So,
I don't know what time. it's gonna be.
Jean, will you be available to answer questions once you're off the board if we have questions?
Yeah. I mean, I obviously won't be attending
Right.
semi-weekly meetings, but I may pop in on your Zoom meetings every once in a while, or you certainly can text me.
I have questions on
Yeah, on the
procedures,
past 30 years.
procedures and protocols and, right, and just your knowledge that you have.
Well,
Institutional knowledge.
going to be institutionalized, is that what you're saying,
I
Tom?
didn't say that. Institutional knowledge.
All right, do we have anything else?
No.
I don't think so. I think you gave us a budget report here.
Yeah.
Just, I want to mention on that, Cindy, clerical part-time, if Jess is done for good, you make sure that your hours use up that budget amount.
Correspond to
You know?
that amount we have left.
Right. So if amount divided by your salary comes up to, 40 hours, make sure that you use all the 40 hours, so you finish all the money in your budget.
Okay, so right
And
now,
get all
should
the
I
work
be
done.
doing 6.8 hours or should I be doing the 10?
Calculators are your balance. I don't know how
Right,
much.
just look at that. Someone
You
sent
know?
that. Someone sent that in to us. Kind of the mail, that would be the mail
Yeah,
folder.
So this is something our nurse can,
Just came out anonymous, it just came in. Someone,
something nurse can,
Huh?
something for the nurse, right?
66 hours. Okay, 67 hours. So, and you have, well, 2 months to do it.
So
Okay,
if
So
Southwick gets
8
money,
weeks
divided by 8,
divided by 8.
where does it go?
8.4.
So, yeah, so make sure you
Tom.
use up.
Say if Southwick gets, if
I don't know, I
So
think
as long
that's,
as
we
I'm
get
doing
funding,
the 10 hours or the 8 hours.
yeah,
So
Right.
don't do 10 yet.
No.
Okay.
And sometimes
wow,
they give us our COLA before the end of the actual
What's that?
fiscal year, cost of living raise. I don't know if they're going to do it, or if they are, how much it is. So just keep your eyes open for a notice from accounting on a revised payroll sheet. Okay?
anything that we don't use in our budget, which we usually always return, goes back to the general fund.
Right.
But we usually always have stuff to return to the general fund because we've been very frugal. This is like the 1 year that
we have.
we've asked for more, but
Have been.
for the past
Right.
30 years, we haven't asked for much.
But keep in mind too, Cindy, that we also have some money under supplies. You know,
Do you need anything?
so for that, you know, pens, pencils, notebooks, make sure
You use it?
you use,
Whatever you
you
need,
get everything you need prior to,
June 30th.
but it has to be invoiced by
Before.
June 30th. Okay? Okay,
So is that budget is just for the Board of Health Secretary?
yeah, that one
Oh, so
line
it's not like
item
me
that I
and
gave
Karen.
you. No.
Okay.
Well,
Oh,
it's
it's
you
Karen.
and Jess. No, Karen has nothing.
She has her own too. Okay.
So I don't know if Jess is going to come back at all anymore.
Yeah, I think she's just available for me, like,
If you
text
need
if I
her.
need her, yeah. I don't know.
And
if she-
you're feeling comfortable, a lot more comfortable now.
Yeah, I'm more comfortable now.
You're right, you're writing things down, so if she's not there, you have a little cheat sheet for
I have
what
lots
you
of
do.
post-it notes.
Good. On Post-it
All
notes.
right.
Okay, we'll put that in for
Okay.
If
supplies.
you have everything
Post-it
you
notes.
need, then you have everything you need.
Okay,
Yeah.
there's another meeting that
Yeah.
has to start here in a few minutes, so,
Okay.
unless, Peter, do you have anything to say?
Or ask.
Yes.
Nope, I'm all set.
Okay.
Thank you.
Okay, so I'm making a motion to adjourn the meeting at 6:46, 43.
A second, it.
Roll call vote. Jean Nielsen, yes?
Sue Broski, yes.
Okay. the
Oh, wait a minute, our
meeting
next meeting is, May
is set
at 6 o'clock.
at 6 o'clock.
Okay.
Okay,